All right, I want to welcome everyone to the Miami-Dade Chamber of Commerce and Jackson Health System workshop on doing business during COVID, safety tips for phase 3 reopening. When we started this webinar, we were in phase 2, but recent changes from our governor, we're now in phase 3. So we want to make sure that we bring in the latest information for businesses moving forward and doing what we need to do in order to feed our families and provide service to everyone. So we have a distinguished panel here today, and we're going to get started at exactly 10:05. In a few more moments, we want to make sure all of our attendees get in. Those that are on Facebook, please share. You can join the conversation by clicking the link. We strongly encourage you to join the conversation. Become an attendee on Zoom so you can ask questions directly to the panelists and engage those that are here today. It's good to see. We have some few folk on Zoom already. That is good. For those that are joining us on Zoom, you can use your chat function to put in any comments that you have. Use the Q&A box for any questions that you may have, and we will get to them at the appropriate time. Give us a few more moments so while everyone gets in. If you are on Facebook, share. If you know a business owner, tag them. This is the information that we need to know and understand from our experts so that we are doing business very well within Miami-Dade County. So I'm excited for our panelists and those today. I'm going to give just a few more seconds and we're going to get started. All right. So it is time to begin the Miami-Dade Chamber of Commerce and Jackson Health System, one of our longtime partners in providing services and resources to the community. We have with us a distinguished panel, but first I want to get some remarks from our president of the Miami-Dade Chamber of Commerce, Mr. Gordon Eric Knowles.
Good morning, and thank you all for joining us this morning. Matthew, as always, thank you for pulling all of this together. It's all about teamwork, and everyone on here, I want to thank you. Amber, it's always so great to see you. And even though, most of us haven't seen one another, we've been Zooming for the last several months, but truly appreciate the partnership that we have with Jackson and your team. Kathleen, thank you for joining us today. And Rodney, you know how I feel about you. Rodney is one of those members that just has taken the bull by the horn and continues to pull other members into our membership, into our chamber, and making sure that we're connecting the dots. And what can I say about my good friend Penny in terms of what he does with the Beacon Council and the work that he has done even before the pandemic? But Mike has stepped up and done so much to make sure that our entire community is connecting. And Dr. Gray, we see you there. She's joining us. She was having some technical difficulties earlier, but that's the thing with Zoom. You may have a little glitch here or there, but we pivot. And that's the one thing about this conversation. A lot is about pivoting. How do you pivot during COVID? So everyone who's joining us on Zoom and on Facebook, thank you for joining us this morning. Matthew, throwing it back to you.
Thanks for having me, guys. I'm sorry, I'm kind of busy. I'm like getting ready to see patient, but I'm in and out. Okay. I really apologize.
And those of you, Dr. Gray is a she delivers babies. Matthew, you're muted, man.
Yeah, Dr. Gray is a OBGYN, and as you know how sorry, OBGY and a business owner, owner of Dukanoo Jamaican Kitchen in Wynwood, a small business owner. As you know how business owners are, we sometimes you have a job and also run the business. So it's amazing to see and have her here today. So she'll be in and out because as babies come when they want, when they need to come. So with that, we'll turn it over to Ms. Amber Lawhorn, who is director of the Small Business Program at Jackson Health Systems, a longtime partner of Miami-Dade Chamber of Commerce. You have the floor, Ms. Lawhorn.
Thank you, Matt. Jackson Health System is happy to partner with the Miami-Dade Chamber of Commerce. The Chamber is a strong partner in helping us get information and opportunities to the minority vendor community. Thank you all to all of the participants for joining us today. It's important to us that small and minority business vendors get information that helps you, especially in this time where safety is a top priority for you and your teams. We received an overwhelming response to the information that we shared with the Chamber in May. In the past month or so, as you know, we've quickly moved into now phase 3 of the reopening. So businesses are opening and booming, and we want to make sure that you and your teams are able to remain safe and also protect the safety of your customers. So this is the perfect time for us to revisit this information and share what we've learned since May with you. And with that being said, I'm going to go ahead and introduce you to our panelists today. I'll start with Kathleen Sposato. She's the Senior Director of Infection Prevention and Control here at Jackson Health System. Kathleen, if you'd like to tell us a little about yourself.
Well, sure. As you said, my name is Kathleen Sposato. I'm the Senior Director of Infection Prevention and Control for the Jackson Health System, and that's a multi-hospital system. I've been with Jackson for 5 years now, and I have to say that this COVID pandemic has been the most challenging and in some ways exciting time that I've had since joining Jackson. I appreciate the opportunity to be here and to speak with your members.
Thank you, Kathleen. Next, Rodney McGilvery, the owner of Dream Clean Miami.
Hello, everyone. My name is Rodney of Dream Clean Miami. I am a commercial cleaning service over 20 years here in Miami-Dade County. I am a cleaning service that also sells and distributes cleaning supplies locally here in Miami-Dade. I want to say thank you very much to Amber and Eric and Matthew, you guys, for putting this together, and I am so happy to be here. And I believe that I'm going to have something a lot safer and happy to tell people about preparing to go into phase 3.
Thank you, Rodney. Next, Michael Finney, the president of the Miami-Dade Beacon Council. And you're on mute.
Thanks, Amber. And Eric, thank you so much for inviting me to be a part of this panel. The Beacon Council serves as Miami-Dade's economic development partner. So we're here to work with businesses of all types, all sizes, in an effort to help businesses grow and prosper here in Miami-Dade County. What we've discovered during this COVID-19 crisis is that many of our businesses, especially the small and Black and brown businesses we have in this community, have struggled to get access to many of the resources they need, starting with the PPP and cleaning supplies and other things that Rodney has available, but also with access to capital and access to even some of the talent they need and some of the other back office support that they need. And so the biggest part of what we're doing right now is really trying to aggregate in one place all the information that companies need in order to help them get out of this crisis that we're in. And so I'll talk a little bit more about bizhelp.miami, but take note, bizhelp.miami is the website that we stood up that literally contains and has aggregated virtually every bit of information that organizations across the community has made available to help. And so I look forward to sharing a little bit more, and I really appreciate, again, the opportunity to be a part of this panel.
Thank you. And we also have, again, Dr. Shrewson Gray. She is the owner of Dukanoo Jamaican Kitchen, as well as an OBGYN. So she's tending to her patients, and we appreciate, oh, here she is, If you
I'm
can
in a
come
room, so I'm wearing AirPods. I'm sorry.
Okay.
Let me just
If you want to tell us quickly about Oh,
Yeah, so I'm Shazanne Gray. I am the owner of two businesses. I own my own practice with a partner of mine, and I own also I'm part owner of the Kuna Jamaican Kitchen. Um, we have definitely my practice is fine. You know, people still need care, but as the owner of the Kuna, it's been a struggle. You know, for the last few weeks, few months, I should say. We were closed for about 3 or 4 months. We reopened back in June, and we have tried, you know, access to get access to all the aids or loans and grants and so forth. It's been a struggle. We've had help here or there. We've gotten access to PPP, so we were able to reopen. And reopening, we definitely, you know, as a physician, I tried to be very strict as far as reopening, mitigation, cleaning up, trying to, you know, ensure that the staff and everybody else fired follow the proper rules. I've even gotten to the point where I've like gotten natural cleaning based stuff that was, you know, healthy for community, healthy for cleaning and so forth. So it's very important to me because I myself, you know, see what goes on in these hospitals and see how sick people can get. You know, that's my little spiel. I'm going back.
okay, thank you. We will be sure
I'm
to add
hearing you guys though. I'm
contact.
hearing you.
Okay.
I have my headphones.
Okay, thank you so much. So we'll go ahead and get started with the presentation. Kathleen, if you can come off mute, I'm going to ask Matt to go ahead and put up your presentation.
Okay,
Matt,
thank you.
share.
All right.
Okay.
And what I'd like to do today is just talk a little bit about what we have gained in knowledge related to the pandemic and the virus. Some people have said we've gone through 5 years of change in 6 months, and I don't think that that's an exaggeration. And when we talk about opening safely, safe is really a relative term. Nothing is 100% safe, and certainly a pandemic is not 100% safe, and we can't make it safe. We can reduce risk and we can achieve a degree of safety, and that's what we really need to try to accomplish. And the way that we accomplish that is by understanding how the virus works, how it's transmitted, because that will then drive our prevention strategies. So the next slide, how is this virus transmitted? Okay, and this is a respiratory virus similar to the common cold or influenza that we're all used to. Unfortunately, the effects of this virus can be much more severe than common cold, and flu often results in secondary pneumonia and even death on occasion. So this is a much more serious respiratory virus, but it is essentially spread the same way. So it's a respiratory virus, as I said, and it goes from the respiratory tract of the infected person to the respiratory tract of a vulnerable person, someone who is not immune to this virus. And essentially, we're all vulnerable to COVID-19. The virus enters us through 3 different ways. Number 1 is the nose, number 2 is the mouth, and less likely but possible are the eyes. That is the only way it can get in. It does not absorb through our skin. It's not going to get in through our hair. Getting it on our clothes is not going to cause an infection. There is a theoretical possibility that if you were to touch a contaminated surface, a surface that's been contaminated with COVID-19 respiratory droplets, get those on your hand and then touch your eye, your nose, or your mouth, that the virus could be transmitted that way, which is what makes, you know, surface cleaning and environmental strategy so important. But it also really emphasizes the need for hand hygiene. Okay. People who are at risk for more severe illness are those who are older. And I don't mean exceptionally older, people in their 40s, 50s, and beyond, and people with comorbidities. And one of the comorbidities that is underappreciated is obesity. So that is considered a risk factor for severe COVID-19 disease, which could, you know, land somebody in the hospital in intensive care and ultimately lead to mortality. One of the other things that I think is not spoken about enough, and we're really beginning to understand a little bit better, are the long-term effects of COVID-19 infection, specifically effects on the respiratory tract and the cardiac system. And those effects are, the duration of them is not understood. They could be lifelong effects, and they affect everybody, not necessarily just severely ill people, but those who have had very mild infection, or even those who have been asymptomatically infected, never developed any symptoms, can experience those long range, very severe physical consequences. And we need to understand that if that happens, that's a pre-existing condition. So that's important. These respiratory droplets can travel about 6 feet, which is the reason for the distancing issue. We need to be 6 feet away from people. And if we could go to the next slide, we can look at where high-risk areas are. And really the 3 top ones, and this is where we really need to be careful. Number 1 is bars. Number 2 is indoor dining. And number 3 is communal gym activities. Wherever you remove your mask and open your mouth, you're at risk for acquiring the infection. And this is where we really need to be very stringent about our safety precautions. And although the patrons in these locations, these business sites, are at risk, I believe that the workers who are in these business areas are at greater risk, just because their period of exposure is going to be much greater, and they will be exposed to many more people. The next slide, what we've learned, once again, we just talked about transmission. It's respiratory to respiratory. The period of infectiousness, or the time that an infected person could possibly infect someone else, is better understood than it was in the beginning. So people can have a positive COVID test for a long period of time, months after they were originally infected. But the CDC has looked at this issue, and the evidence is that people are infectious for about 10 days after they have either developed symptoms of COVID-19 or they've had a positive test. They're also infectious for 2 days prior to development of symptoms. So that's important. There could be a lot of people walking around who have been infected. They have not yet developed symptoms, so they're not aware of that, and they can spread the infection, especially in that 48-hour period before their diagnosis has been determined. Testing progress, we're continuing to look at different types of tests. PCR is still the gold standard. If it's positive, it's positive. It's negative, most likely it's negative. But once again, you can have an extended period of positivity with the PCR test that if you've gone past 10 days, most likely you are no longer capable of spreading the infection. Treatment options remain pretty much the same. For mild infection, it's really just symptom control and obviously self-quarantining. For more severe illness, there's still remdesivir and steroids for people who have been hospitalized or who are critically ill. Long-term effects, we mentioned that just a little bit briefly, essentially affecting the cardiac and the respiratory symptoms, and the duration of those effects may be permanent. And there have been very, not isolated, but there have been cases of people who have just experienced what they call long-term COVID-19, where they're just experiencing a lot of fatigue and just not feeling well, not really unable to go back to work because of the kind of vague, unspecific symptoms that they continue to experience, even though they're no longer infectious and wouldn't really be considered infected. We'll talk about prevention in a little while, and I hope that we're close to identification or the development of an effective and safe vaccine. There are several that are in phase 3 trials right now. It's most likely that it's going to take 2 doses of the vaccine to establish immunity the first time out, separated by 3 or 4 weeks. So it will take a lot of work and a lot of time for us to establish what we would call herd immunity based on the vaccination. The next slide. Okay, and knowing how the virus is spread really guides our prevention strategy. So you see that picture on the left, masks. The mask is probably the #1 strategy that we can implement to prevent the transmission. And the mask is not only protective for the people who are wearing the mask, but everyone who's in contact with them. So if I have COVID-19 and I have respiratory droplets that are infectious, if I'm wearing a mask, those droplets will, the vast majority of them will be captured in my mask, and they They won't be able to transmit to another person's nose, mouth, eyes, or surfaces surrounding me. Eye protection, once again, is not as emphasized as a prevention strategy, but really is an adjunct to wearing the mask, protecting the mucous membranes of your eyes. It not only protects the eyes from being in contact with respiratory droplets in the air, but it also keeps your hands, which may be contaminated with respiratory droplets, away from your eyes. Social distancing, I think we just need to start calling it distancing. It's not necessarily social distancing. We need to stay 6 feet away from people that we don't know to the degree possible, and avoiding crowds, as you can see up in the upper right of the slide. That's not a good situation for a pandemic time. And at the bottom, hand hygiene. If environmental surfaces are contaminated, or if we have, once again, touched something that is contaminated, and then we touch our eyes, our nose, our mouth, that is a way that we can transmit the infection to ourselves. The next slide. Okay, so what we can do at work. And there are a lot of things, and most likely dependent on the type of business that you're involved in, but make hand hygiene convenient, mandatory. There should be hand hygiene products, most likely sanitizer, at entry points and then throughout the business. As much as possible, we should engage in virtual meetings, just like we're doing now. If we have to have in-person gatherings, 5 people, and based on the size of the room that you're meeting in, anytime you can move something outdoors, it's going to be less risky than doing something indoors. Avoid gatherings that involve mask removal. If you need to celebrate at your workplace, now is not the time to get a cake and everyone get together and eat it, okay? Think of something else that doesn't involve food if you're going to be together. I would also suggest, if you're working for 8 hours, 10 hours, 12 hours, obviously you need to take a break, you need to eat. We're going to have to get to the point where we can separate eating from socialization, and that just is so counter to everything that our society and our community is about. But we need to really separate out that eating piece where we have to take off our mask, we have to open our mouth, from the socialization and the chatting about what's going on at home or whatever. Two different things. If we can keep those separate, that'd be great. Remote work to the greatest degree possible. If a worker tests positive, if you have someone in your business who tells you that they've been infected with COVID, you need to identify the people that they were in contact with, most especially the people that they were in contact with when they had their mask off. If everybody's wearing masks, you have not had an exposure. But if that person who is now infected has had unprotected contact with another coworker, that other coworker really needs to be cognizant about monitoring for symptoms. They may want to get tested. It takes 4 to 5 days for the virus to start replicating. So if an exposure happened yesterday, it wouldn't make sense to get tested today, but wait till, let's see, yesterday was Wednesday, next Sunday or Monday would give the person time to have developed the infection. They really need to be very meticulous about wearing a mask if there's the potential that they were infected by their coworker. If we can stagger work and break schedules, people not coming in all at the same time, people not taking breaks at the same time. It is still important to screen employees and even customers. Temperature screenings are not really that effective, especially, those thermometers that you point at somebody's forehead. They can be, give invalid results. It's really a question of what kind of symptoms the individual may have had. I would also suggest that now we need to start talking about people's exposure to other infected people. And with the phase 3 reopening, were you in a bar over the weekend? Did you go to a restaurant and eat indoors? And that doesn't mean that those people can't come in or that they can't work, but they really need to be careful, especially about wearing the mask so that they're protecting other people, just in case they became infected while they were having fun over the weekend. Maintain distance, 6 feet whenever possible. Ventilation, the more we can, clean the air that we're breathing, that our customers are breathing, the safer we will be. OSHA has a lot of information about what kind of ventilation improvements can be made. Make sure that there are trash cans for used masks. We don't want those just thrown on the floor where someone else is going to have to pick them up, potentially contaminate their hands and get rid of them. Hand sanitizer, we talked about that already. Entry points and then throughout the business. If you can, ensure that there's one-way traffic. Come in one door, go out another. Reduce seating in common areas. Once again, trying to distance break rooms, lounges, going outdoors whenever possible reduces the risk significantly. Visual cues to promote distancing. So not just telling people that they need to stay 6 feet apart, but putting marks on the ground that delineate where 6 feet are. Discourage valet parking. You don't want to put your employees in someone else's car that may have been contaminated. Discourage unnecessary visitors and contractors. And if you have an elevator, limit the capacity in the elevator and encourage people to stand in the corners facing the walls of the elevator, not each other. And I think that might be it.
So Kathleen, thank you very much for that information. I'm even a bit caught off guard because just based on being back out in society here and there, you don't really get the sense that people understand that we have to be as diligent as we were at the start. We can't start backing off now from being vigilant about the safety precautions and really taking as much, safety, efforts as we can. So.
And I think that a lot of people are getting mixed messages. Phase 3 reopening is essentially, I think, an implicit message that the risk has been significantly reduced and we are trying to get back to normal. And we really need to wrap our heads around the fact that we may never get back to what was normal before the pandemic struck, but we are certainly not going to get back to normal for a long period of time. I anticipate that we will be wearing masks through at least the first quarter of 2021, maybe through the summer of 2021. And I know that people do not like wearing masks. I myself do not wear one, or don't like wearing one. I do wear one. But it is our #1 prevention strategy. And it's, once again, not just about the person wearing the mask, but about everyone with whom they have contact. And essentially, we have become our brother's keeper in this pandemic. And especially, due to the demographics of our community, we really need to be exceptionally considerate of everyone that we're coming in contact with. This virus is not equitable, and it's affecting certain populations more than other populations. And it really is our job as good citizens and good neighbors to do everything that we can to protect each other.
Thank you, Kathleen. I'm really glad that you brought this information to the vendor community today. And something that you mentioned is that we may not have the normal that we used to have. So with that, I'm going to ask Michael, there's a new normal task force that you sit on with Miami-Dade County. If you could come off mute and let us know what is that task force and what's your role on that?
Yeah, thanks a lot, Amber. So back in, I think it was April or May, the Miami-Dade Commission established what's called the COVID-19 Economic Recovery Task Force. Initially, there were 20 members, and of course, Eric Knowles, of course, the president and CEO of this chamber, is one of the key members of that group as well. And frankly, I was fortunate enough to be selected as a member and as the chair of that committee. The work that we've been doing falls into 3 different areas. First and foremost, it is, what can we do to help our small businesses through this recovery? Second is, let's help tell the story of Miami-Dade more effectively through marketing, so that we're out there again and communicating all the wonderful attributes of why Miami-Dade, from both a quality of living standpoint and from a business standpoint. And then third is to go out to our citizenry and to our businesses and survey them to make sure that all the actions that are being taken are in fact the right kinds of actions. So we've got a group that's focused on this new normal that we're going through and what are the real needs of our citizens and our small businesses as we move into this new normal that Kathleen just described. And so the committee's work has been ongoing, meeting multiple times during the week in the various task or subcommittees, and really developing a comprehensive set of recommendations. And I think between the 3 different working groups we have more than 30 recommendations that we've now presented to the Miami-Dade Commission for their consideration. And we're asking them to put resources behind these recommendations so that this community has the highest probability of coming out of this crisis that we're in and getting back to some state of normalcy. So that's the primary work that we've been involved with. It is a tremendous undertaking with lots of external parties involved beyond just the 20 plus members on the committee. There's a lot of external organizations that's also working with us in order to make this happen.
So you talked about some of the recommendations that you've made based on the feedback received from the business community. Could you give us 2 or 3 of those recommendations? I think the attendees would benefit from hearing what is before the county for consideration.
Yeah, one of the more critical ones for the small business community is a need for us to provide a whole suite of what I'll call wraparound services that small businesses need that are not normally things that they have access to. So for example, when all of the PPP loans were available through the CARES Act, literally thousands of small businesses in this community who would have on paper been eligible were not eligible because they couldn't get a loan application completed, right? And when we started to work with those companies to try and figure out what's going wrong and why can't they get access, we discovered that in most cases, their back office and all the documentation they need to validate their business status. That could be payroll records, it could be financial records, it could be IRS documentation, their tax certificates to show that they are an active business in the state and locally. Those are the kinds of things that were required of these small businesses in order to be eligible for those loans and grants. And in many cases, they didn't have that kind of documentation and couldn't easily pull it together, and as a result, weren't eligible. So one of the biggest recommendations coming out of the task force is actually to provide that kind of technical assistance to these businesses in a holistic way. And we've actually organized about 26 different organizations in this community, including the Miami-Dade Chamber, but other organizations like the FBDC at FIU, Goldman Sachs 10,000 Small Businesses, Camicol, Prospera, and so many others are working with us to really try and deliver those services to the small businesses so that as future crises happen, they have access to the funding that they need and have access to other resources that are available to more established companies. So the goal is to try and say, okay, let's fund this activity so that these partners, all these different organizations have the resources they need in order to help these companies. A second one is funding. The nice thing is that one has already been addressed, right? Miami-Dade County stood up the RISE Fund. That fund is a revolving loan fund that's there to help small businesses that need access to capital, because we know that's the single biggest need. And for those businesses that didn't get access to the PPP and other programs, there is now a local fund that they can apply to, and they can get help from this consortium of organizations that I described earlier that's willing to work with them to help them get an effective application completed. So that's some of the work that's coming out of the committee. There's also a needs assessment survey that's out in the community right now that's surveying businesses and individuals, very important. And then most recently, the GMCVB, Bill Talbert, is leading the marketing component of this project, of this task force. And Bill Talbert and his team are working on some marketing initiatives, and the commission just recently authorized, I think, up to $5 million of additional resources to help with some of our marketing activities. Now that would go through the GMCVB, but we know that their reach is pretty amazing when it comes to helping our tourism and hospitality businesses return. Just like the doctor's business, it's in that hospitality space. She's been shut down, and hopefully the work that the GMCVB is doing will allow them to really get back up and running in a more robust way.
Okay, and GMCVB is the?
Greater Miami Convention and Visitors Bureau.
Okay, for the benefit of the attendees on the call.
Absolutely.
So you talked about a number of resources. Sometimes small businesses just don't realize how many resources are actually out there to help them now. They're just, focused head down trying to do the work. You talked about Biz Help Miami a little earlier. Do you want to expound on that?
Yeah, thanks for bringing that back, Amber. So BizHelp.Miami is a portal that we stood up when this crisis first happened, right? Because there were just so many different resources made available, the biggest being the Payroll Protection Program, or PPP as it's commonly referred to. But there were many other loans and grants that were being made available, some by local units of government, some by the county, several from the state of Florida. And then there was all kinds of help for individuals, whether it was food or shelter and other resources. And so what we decided to do was to aggregate all these different programs in one location so that our community, our citizens, and our businesses could easily find all these resources in one place. So it is bizhelp.miami, and you can go there and you can find capital, you can find talent, you can find various programs that's there to help individuals. It's all there, and it's fairly easy to navigate. And if you have any difficulty, there's a chat bot that allows you to just ask a question, and everything is translated in 3 languages. Of course, our dominant language being English, but it's also translates into Creole and Spanish, because those are the other 2 dominant languages that we have here in Miami-Dade. So we tried to make it as seamless as possible. It's a tremendous resource, and I would encourage all the small businesses here to at least check it out. And if you have any difficulty with anything you're looking for, please reach out to us. There's a direct email link also that will allow you to directly ask questions of us as a follow-up to anything that you see on bizhelp.miami.
Thank you, Michael. So I believe Eric put the link in the chat. So make sure that you copy that. bizhelp.miami is a website that includes all of the information that Michael just mentioned. And also keep an ear out for some of the activities that the New Normal Task Force are able to help get to the small businesses in Miami-Dade County. So I would like to go back to Rodney at this time. Kathleen talked a lot about some of the efforts that businesses need to consider in terms of keeping their employees safe. In the nature of your business, I imagine that the majority of your employees are actually outside of your own office. They're working in someone else's work environment. Tell us a little bit about what you've been able to do to keep your employees safe and some of the considerations that you may have now after hearing the information that Kathleen shared.
Thank you so much, Amber. Everyone, my name is Rodney from Dream Clean, a 20-year cleaning business here in Miami-Dade. I'd really like to take this opportunity in running a cleaning company. The first thing with my employees is I had to not take the fear out of them, but give them an alternative to fear, because we just know that live life in fear is a life half lived. So we thought we'd take it out on that. And as we go to each building, as we communicate throughout each building with the customers, instead of us reaching back to a new normal, as some would say, we thought we'd pivot. But when we pivot as a company, Dream Clean, to approach our customers and not take the fear out of them, but give them an alternative, we reached out to give them ideas. We reached out, and it wasn't a secret. The ideas was what the cleaning personnel did every single day, you know, because we don't want to take money out of the cleaning company's pocket, but we must communicate with all customers that have them, your customer, as an ally to help keep offices clean. I'm going to go through a few items that a person, I hope it doesn't shake. I have customers on and have many cleaning companies. I always think the same way every time. And that is, when you walk into a workplace, it's not just about being health, making it safe, you know, and I'm going to put that safeness on every single, on my mask. I know I'm protecting my daughter at home. Every time I see people wearing masks, I'm protecting them from me, because no one knows. I believe that everyone should have a mask on whenever you are within or around anybody. So whether you're in the office or whether you're working outside, always wear your mask. It's very important. But for all the people who are dealing with the employees inside their workplace, one of my major things is making sure the air quality inside office is great. And business owner, I'm just going to say to you, I hope it's not anything that you haven't heard, but make sure your AC filters being often as possible. I would say some month. In some of the places that are not, the AC filters
Rodney,
change 3 months.
Rodney,
So
you shared a really important point, and I think some of us may not have heard it. You shared a really important point. I think some of us may not have heard it about the air filter. If you could go back over that.
Yes. I have discovered over the last 20 years in business, it started with apartments, but I noticed apartments that we were going in to clean, it was always dusty. And I always wonder how an apartment on the 7th floor in the back is always dusty and they never open the windows. Well, the problem is that the husband and wife who walked in the apartment every day brought it in on their shoes. They sprayed it all over their floor. The AC picked it up from the floor and it blows it over the furniture. So when I commented many times, when's the last time you changed their AC filter? I would say 8 out of 10 was, we have an AC filter, you know. Or I have walked into a dentist's office that I'm not gonna disavow, and they wanted me to walk around and give them an estimate on cleaning the dental office. And I thought that everything they sat on, touched, moved around, everything was clean, except the top of their shelves, the top of the exit lights, the top of doors. And when I walked to that AC closet, it looked like 5 of my cats were in there. So all the people in the dental office, the hair was being sucked into the AC filters. And even though they had a very clean office, their air quality was poor. So over the last 20 years, even in our vehicles today, we carry 20 by 20 filters and 16 by 20 filters just to give to the customer. And I've had husbands and wives who were sick, who were not sick anymore because they changed the AC filters. So walk into me that they don't need a cleaning company. They need to change the AC filters more often.
That's very important. I think that's information that most of us don't think about on a regular basis. So I'm really glad that you shared it. And I also enjoyed what you said about making your customers an ally and keeping everyone safe.
I just want everyone to know that if you are walking water from outside to inside of your office, have some type of mechanism to make sure that that water is dried up, and make sure you're using disinfectants to make sure that things are clean. You want to try to use green products, you know, you're going to be around people all the time. You want it to be healthy, and you want the air quality to be well. And number one, but not least, is make sure you empty your garbage. The garbage is the worst place that causes air quality problems within an office, especially if you're sharing offices with people. People come in and they take everything out of the purse, out of their pocket, the receipt that the guy at the gas station, they throw it in the trash. So if you do not empty your trash regularly, and don't say, oh, the cleaning people will do it, because within my organization of Dream Clean, my customers and I work together. I have been able to very strategically give customers who were facing a $1,200 a month bill for cleaning, and now I give them a $300 a month bill for cleaning, because the customer works also with the cleaning company to make sure the trash cans are empty. And I'm going to give everyone a tip who are germaphobes about touching things. When you get out of your car, have a sanitary wipe with you. Have a paper towel and a sanitary wipe. My employees, as they walk from building to building to building, we never touch a handle, and sometimes 12 buildings a day, because they take off with them with disinfectant on them, and they use off throughout the time that they clean, not this surface, so opening doors, closing doors, and we do kind of a twofold. We walk into your building, 80 units or 150 units or 800 units, and we make sure that every touch surface has been disinfected. So if you as a business owner have your hand sanitizer around, you know, and if you say, Rodney, I can't find wipes, get a roll of paper towels, spray the hand sanitizer on your hand, and then wipe your paper towel, and then walk out of your building. When you get to the trash, throw it away right before you get in your car. You don't take germs from the office, and you don't bring germs in the office from shopping, having, and going. And I would like to tell everyone, sitting down, you want to be diligent about what you're doing. You want to be diligent about leaning on tables. You want to be diligent about, okay, all 5 of us can get in the elevator, because the responsibility is going to lie with each and every one of us to do the right thing. And it's not being in fear, it's just an Amber. The right thing, every.
Okay, thank you, Rodney. So again,
and developing really good habits. We'll be able to move into the next era.
Thank you, Rodney. So again, about air quality, protecting your air quality. I think he mentioned changing your air filters, making sure you have some mechanism to catch water when you're coming into the house, and emptying the trash, very important. And then being sanitary with your hand hygiene. That was an excellent tip, to take that napkin and the sanitizer spray, you know, to make sure that you're not carrying what you touched when you were in the building, and also not transposing any of that into a building. So thank you for sharing that, Rodney. And like you said, not living in fear, but being equipped with the tools that will keep us safe, or help us to be safe, be as safe as possible. And Kathleen, I want to jump back to you really quick, talking about the tools. If you could come off mute and tell us, I've seen you very active in the chat, encouraging us to get a flu shot this year. Can you tell us a little bit about that, how it relates to what's going on?
Sure, and hopefully some of the strategies that we've implemented to prevent the transmission of COVID-19 will also reduce the potential for transmission of influenza. But there is no evidence that you can't be infected at the same time with both flu and COVID-19. And I think that would be a very scary situation. So this is truly the year to get your flu shot. They're available now. Get it as quickly as you can. It doesn't matter how early you get it. It will last you through the flu season. Once again, we just don't want to have both infections at the same time. And wearing the mask is not only going to, you know, prevent the transmission of COVID-19, but we believe that it's also going to be instrumental in preventing the transmission of influenza. So thanks for letting me say that.
No, thank you. This is information that we need. That's why we have you here. I'd like to quickly go to Dr. Gray, if she's available. I know she's listening in as she can, but that baby may have decided that this is the moment that they want to come in, and there's nothing we can do about it, and that's fine. Okay, so I'll go to Eric. Eric, if you could come off mute and just tell us a little bit about what the chamber is doing. I think you're also, Michael mentioned you're also involved with the New Normal Task Force. So can you tell us about your role on that as well, and then what the chamber is doing to help its members?
Very much so, and thank you, Amber. Yeah, I sit on the task force. I chair the small business group, and we meet actually every Monday and Wednesday, as Michael said, bringing recommendations to the overall task force that can be submitted to the county commission. What the challenge actually is beginning, Michael didn't talk about this, but a lot of our meetings have been, all of our meetings, as a matter of fact, have been on Zoom. But because of the governor moving into phase 3, actually all Zoom meetings have to actually cease. School board meetings, they now have to meet in person. Beginning today, we actually were going to have one of our, anyway, next week starting, we're not able to meet via Zoom. So we're going to have to meet in person. Go ahead.
Michael has the finger up.
Yeah, only because the governor apparently extended the executive order through the end of October last night.
Oh,
so we at least have through the rest of this month that we can still meet remotely. So that just happened last night.
oh, great! Glad to hear that, because we were all, I wouldn't say panicking, but obviously as we're talking about what we're talking about, being safe. Where can we meet in person? That was one of the questions we had. Where is there a place even within the county that all of us, 20 or more people, can meet and social distance? So those are the things that we've been dealing with, and even dealing with the and I'm going to go a little deeper. And I'm as I'm saying this, Michael and I are in a task force, so we can't really even engage in a conversation about these things. But there's several tranches of money out there. There's $30 million that restaurants have been put in place for restaurants through the COVID-19. There's another $30 million through the RISE program that Michael mentioned. So our job as from the Small Business Task Force or group to ensure that businesses know that this information is out there, and making recommendations again to the commission on how we get this information to these businesses, making sure that they know that like bizhelp.miami, all those things that Michael already mentioned is what we do as a task force. From the chamber perspective, we continue to meet when the pandemic hit. We were talking and letting the business community know about PPP, letting them know about the PPEs, letting them know about the EIDL loan programs. And even right now, a lot of folks don't know that EIDL is still available. The emergency monies that are disaster money, that's still available. So if you haven't applied for EIDL, please go to the small SBA, and it is through the SBA that you can apply for this EIDL money. There was also a $10,000 grant through the county that was given to Tools for Change. These were for businesses for reimbursing you for maybe you had to buy a computer so that you could do these Zoom meetings and other needs that you may have. And so that was up to a $10,000 grant that you can get. There's a small business loan through Tools for Change and PPE, PS, all these different letters, PSE. It's a loan that will be turned into a grant up to $25,000 if you do within that year everything that you're supposed to do. And even the chamber, we have a micro business loan in which we reduced our interest rate down to 4%. So if you are in need of a loan, you can reach out to the chamber for that as well. So again, Amber, we've been meeting as I said, when the pandemic hit, we were meeting every day. And so then we switched to a couple times a week. And even now we meet on Tuesdays and Fridays. We have a member we engage so that we can share information, provide information, and make sure that the members are connecting and also doing business with one another. Speaking of Dukanoo, we know it's challenging. And I know, as Kathleen said, we definitely have to be careful in how we do what we do in as far as engaging with one another. But at the same time, we do have to support our businesses out here. Our economy is not going to grow. We have to get people back to work. So one of the things that we are going to be doing on October 16th is actually having a meetup at Dukanoo and have safe social distancing, because the one thing great about Dukanoo is that they do have an outside space. So those are the things that we are doing for our membership and making sure that we stay engaged and keep businesses thriving and growing.
Thank you, Eric. And I just want to acknowledge Michael Finney. He has to head off for another appointment. If you just like to say a parting word, if you come off mute.
Thanks, Amber. And Eric, again, thanks for allowing me an opportunity to participate in sharing this very important information. If there's ways that we can be a resource through the Beacon Council to any of the listeners, the businesses or individuals, we are a pretty resourceful organization. We're here to be a resource to this community, and we really want to be a resource. So we've developed a pretty deep relationship with the leadership through Eric and the team here at the Miami-Dade Chamber, and we just look forward to greater collaboration. Last thing I say is, if you haven't registered, we're down to the last day or two to register. If you plan to vote, please get out and vote. It's really important. Thanks.
Thank you. Thank you. Okay, I'm going to ask.
Remember, if I may, Mike reminding us about voting, also the census. We definitely, I think the census is the last day is the 5th
Well, I saw that it was extended to October 31st. I just checked it.
There's another extension, okay.
But that's very important that you mentioned that. We've been sharing that with the businesses in Miami. You think census as it applies to an individual, but the census really determines how communities receive funding. Jackson depends on an accurate census count. So please definitely complete your census. You can do it online, it's very easy. And then also, if you're not already registered to vote. So I'd like to go back to Kathleen, and I think I'll do this before we go to the Q&A. So if you have any questions, please post them in the Q&A chat and we will get to them in a moment. But Kathleen, there are rumors of a third wave possibly arriving. What are some of the things citizens, not just business owners, should take into account as it relates to the potential of a third wave?
I don't think that those are rumors. I think a third wave is inevitable. I'm not sure it's going to impact Miami as significantly as the second wave did. The virus seems to be moving from location to location within the country. Right now, it looks like the Midwest and the West are being negatively impacted by the pandemic and this third wave. But I think it's almost inevitable that we will see some effect. We've already identified the fact that there are more tests being performed right now, and we're seeing a very slow uptick in hospital admissions with COVID diagnoses. So with the reduction in the restrictions that we've just experienced, and I'm glad to hear that those meetings can be done by Zoom and they don't have to be done in person. That was really worrisome. I think what we really need to do is to look out for our very vulnerable populations, the elderly, those people with comorbidities, either cardiac disease, diabetes, renal failure, people who've had transplants, people with cancer, anything that puts a person at increased risk for severe illness. They need to be especially careful. If they're going to eat restaurant food, they should be eating that outdoors or taking it home to eat. They really need to avoid crowds. They should never be anywhere without their mask. And once again, it's our responsibility as citizens and members of a community to do all of the protective things that we can do, whether we have comorbid conditions or not, to protect the people that we're riding in the elevator with, or the clerk at the grocery store who's checking out our order. It's our duty to be as safe as we can be and to help them be as safe as they can be. One of the reasons that I emphasize the flu vaccine is we are definitely going to see increased cases of COVID-19. But once again, we don't want those to happen at the same time, flu and COVID-19. Focusing on environmental cleaning and disinfection, maintaining distance, hand hygiene, wearing the mask, protecting your eyes. We need to do those before the wave hits, and certainly when the wave hits. And I think we need to be very cognizant of any restrictions that could be imposed by our local government based on an increased number of positive results and increased number of cases.
Thank you, Kathleen. And I want to just reiterate to our attendees, Kathleen is sharing her perspective from the science and also from working within a healthcare system. So what's going on out there, we're seeing inside here because we're treating those patients. So Kathleen, I really want to thank you for sharing that information. We're going to go to a couple of questions over here in our Q&A that may have already been answered, but if you could just go over them again. Kathleen, how does telemedicine play a role in these times? And is Jackson partnering with companies that can provide this service?
Well, Jackson does do telemedicine. We have that capability to engage in telemedicine. And for to reduce exposure, both of patients with COVID or patients without COVID, to maintain distancing and avoid congregate settings, telemedicine plays a huge role. And I think medicine is never going to be the same, even after the pandemic is over. I think we have identified some very effective ways to make medicine and the delivery of healthcare more efficient during the pandemic, and that will probably continue long past the pandemic. So telemedicine has played a huge role in maintaining the health status of our citizens.
And you know, Kathleen, something I saw just last night is a reminder. I think hearing it from you would be impactful. But you know, in this time, some people have taken step back from routine visits, routine health visits, you know, just trying to figure out if it's safe to go to this doctor or that doctor. What are your feelings on that at this point?
During this lull is the time to get your stuff done. If you need, you know, dental work, you need a physical exam, you need tests, whatever. We are not yet in that third wave. The positivity rate, I think, is down to 4.8%. That was on the 29th of September. Now is the time to seek health care.
And it's important to stay on top of it, just as important as before, if not more. Thank you. We also have a question. Who or what department will one contact over at Jackson to introduce the service for business opportunities? So if you're interested in doing business with Jackson, please go to our website, www.jacksonsmallbusiness.org. Again, www.jacksonsmallbusiness.org. There are links there with information, and then also information on how you can get in contact with our team here to help you figure out where you fit in our process. Okay, I don't see any other questions right now. So with that, I'm going to turn it back over to Matt. And thank you to our panelists today. Thank you very much for your time.
Thank you, Amber, for again partnering, Jackson Health for partnering with the Miami-Dade Chamber of Commerce to host this distinguished panel in order to provide our business owners and the members with the resources they need to understand how to get back to business. Thank you very much, Ms. Sposato, for the insight, the data, and also the information needed. Mr. Rodney from Dream Clean for providing a very good analysis of what we need to do as people and business owners just to make sure our work environment is taken care of. Those thoughts about the air filters and all those are things that I didn't even think about. So much respect for sharing that. Also, Dr. Gray, when she jumped in at the very beginning, giving the insights about being a business owner of two businesses and OBGYN and also Duke New Kitchen in Wynwood. Amazing Jamaican cuisine in Wynwood. And then we want to give shout out and respect for Duke New for joining us on this. And last but not least, also Mr. Michael Finney, chairman of the Miami-Dade New Business Task Force, for giving those insights on the committee of people that have been coming together to ensure that our businesses move forward. Here at the Miami-Dade Chamber of Commerce, We are there day to day. We host these workshops at least once a month so that our business owners have the latest information. It is very critical as we do business as small business owners that we have the best information. That's what we do with the Miami-Dade Chamber of Commerce with these technical assistance workshops. We also provide one-on-one technical assistance. That's what sets us apart in a lot of technical assistance services, that we provide one-on-one consultation where you can basically focus on getting your back office together. That's been the biggest impediment to taking advantage of opportunities that we have seen, is having the back office together, which is the bookkeeping, the financials, the licensing, insurance, all those things. And we work with business owners to get themselves to that point, along with business planning, setting their goals, figuring out how to pivot, and certifications and capabilities statements. So you can always go to our website, www.m-dcc.org. Check out our services to find more about the technical assistance. During this time, we do have a capital program, a microloan program that's been in existence before, and during this COVID, where we actually reduced the interest rate down to 4%. And one of the special things about our microloan program that is much different than the PPP and all those others is that we work with you so that you can get your business to a point where you can get approved. So we're one of those programs where you don't just submit an application and wait till you get approved. We will work with you to make sure that your financials are together, give you some time to do what you need to do to create a really good access, because this program is about building your ability to access capital. And we're one of those first programs that provide that capital moving forward. So once you get things together here at the Miami-Dade Chamber of Commerce and our program, you will have what you need to access capital from any other markets here. So those are some of the things we do as a chamber. I'll strongly encourage you to go to our website, look at the upcoming events, because we currently have periodic events coming up. And also every Tuesday and Friday, we have a small business meetup where business owners come together and they share the latest information, any challenges. It's been a really good opportunity to connect with other business owners during this time where networking opportunities have been limited. And it's been a life-saving and blessing for a lot of us that have been participating in these calls. So we strongly encourage you to go to our website to sign up for those small business meetups and meet up with other business owners. With that said, Ms. Lawhorn, again, thank you very much for moderating this panel and for all of our panelists. And I'll turn it over to our president, Mr. Eric Knowles, to close us out.
Well, once again, Matthew, thank you for pulling all of this together. And Amber, can't say thank you enough for all that you continue to do to help small businesses grow. And it, obviously, as the Black Chamber, we appreciate you making sure that Black businesses connected to Jackson Hospital. I know we just went through, or you're still working on your bond program, in which we had the Mentor Protege program, and many of our members participated in that. Can you mention where you are with the bond program at this point? I know we didn't talk about that, but let's talk about that just a little bit before you go.
Okay, so if you've been on our main campus recently, you know that we've opened a brand new rehabilitation hospital. If you've been on the 826, I think it's 826, then you've seen that our Jackson West campus is very close to completion. So with that being said, we've been working on this since 2015. It's now 2020. We're wrapping up a lot of our bond program work. A lot of our facilities have been updated. If you've been to any Jackson facility recently, it doesn't look like what it looked like a few years ago. So by next year, we should be wrapping up the major projects. And then, you know, as we can throughout the years, we'll continue to try to revisit as funds allow.
Yes, again, thank you so much. Kathleen, thank you. Rodney, obviously, we appreciate you again, all of you. And Dr. Gray, appreciate her being here, as well as Mike Finney. Thank you all for making this information available to our
To
members
see it.
and to the general public. Who was that? Who was that?
That was me. Can't see you. Hold on. That's me, Dr. Gray.
So we're closing now. We just want to say thank you. Anything that you'd like to say before we go?
Oh no, really, I really am grateful for the opportunity, even though I've learned a few things that I don't think I knew before. So I think this is a very good venue, a good meetup. You should do that again next week. No. But thank you so much for having me.
We do it every Tuesday and Friday for the membership, but I don't know if you heard me. We're coming to Dukanoo on October 16th.
Oh, really? What time? 16. Let's look at that time. Date. What's that date, guys?
The 16th,
October 16th.
Friday.
Oh, Friday. I might be able to do it. Do I have anything on the 16th? What time? What time are you coming?
We're coming at 4 o'clock because we do our meetups on Tuesdays and Fridays at 4 o'clock, and it's been Zooms. But the fact that you have outdoor space.
Yes. You know, I think I'll be trying my very best. The only thing that will stop me is a baby.
Okay.
I will actually try to make it there. Thank you for letting me know that.
Yes.
We'll put on my schedule.
You know already, but we've been busy, like you said, delivering babies, running a restaurant. I know you can't keep up with all of it, but I know you do a great job. So, and that's why we want to support you and support your business and let people know that you are in Wynwood, I believe on 24th Street. 24th
Street. We're in 24th Street.
Give everyone the address so maybe they can stop by even before the 16th.
Yeah, 316. I'm always confused. Southwest 24th Street, right across from, well, it used to be Concrete Brewery. That's closed now. What else? From Wynwood 25. So our street is now getting pretty popular, actually. It's like becoming like, it seems like it's becoming the restaurant street. We were the second one on that street, believe it or not, but now I think there's like 4 more showing up there.
Right.
So it's in between 5th and 2nd.
Right, and I tell people to enter from 5th, go to 5th Avenue because it is a one-way street.
It is a one-way street, you're right.
From west to east, so go to 5th Avenue and come down 24th Street, and Dukanoo is on the right-hand side. You're gonna love the food, you're gonna love the drinks, the atmosphere. Just a really wonderful place in the heart.
Yeah. And what we've seen a lot during this time is, thank God for people. We've seen so much support, and we've seen so much love from the community, from the African American community, and the minority community, you know, based on the fact that we own, oh, very good. Yeah. Based on the fact that I feel like there's some level of like ownership, you know, that they own some, our people have something in that area. And so you know, that's one of the reasons I held on so tight despite all the struggles of getting it open. So, but we welcome you all.
What she's talking about, actually, as she's been open, what, a year now?
Exactly. Yeah, a year and 2 weeks.
Okay.
A year and 2 weeks.
It's been a year and 2 weeks, but she had challenges before, almost 2 years open because of the challenges she had with her contractors. But she, as she said, and we need to support that business. So that's it for me, Matt. Again, thank everybody for joining us, and look forward to join us on Friday, which is tomorrow. Tell them where to go, Matt.
Go online, www.m-dcc.org, click events, and you'll see all of our upcoming events, including our small business meetup. With that, I want to thank everyone for joining us. Continue to follow the Chamber. Become a member of the Chamber using the same website so you continue to support the work that we're doing to ensure that small businesses, minority, Black-owned businesses continue to thrive no matter what the situation is. Pandemic, no pandemic, we're here to make sure our businesses thrive and shine. So thank you very much, and everyone have a great evening. Take care and mask up.
Thank you.
Thank you.
All right.